Ebola continues to claim more lives, with warnings that several African countries could also be at risk. Uganda confirmed that 3 new Ebola cases were reported on Saturday as concerns grow over the regional spread of the virus. The World Health Organization has raised the risk level of the outbreak in the Democratic Republic of the Congo to very high. United Nations allocated $60 million fund to accelerate response to Ebola outbreak in the Democratic Republic of the Congo. More in the next report.
Ebola is spreading rapidly across parts of Central Africa, promoting health authorities to intensify efforts to contain the outbreak before it develops into a wider regional crisis. The Africa Center for Disease Control and Prevention on Saturday held its second emergency briefing on the worsening situation in the Democratic Republic of the Congo and Uganda. So far, 82 cases and 7 deaths have been confirmed in Democratic Republic of Congo. WHO says the real scale of the outbreak is likely far larger, with nearly 750 suspected cases and 177 suspected deaths reported. The provincial authorities have banned funeral wakes and also restricted public gatherings to a maximum of 50 people. Earlier on Friday, the UN World Health Organization raised the national risk assessment for DRC to very high, although the global risk remains low. The current Ebola outbreak is caused by the Bundibugyo virus strain, and there are currently no approved vaccines or treatments for it. As global health authorities work to contain the ongoing outbreak, scientists at the University of Oxford are developing a new Ebola vaccine that could enter clinical trials within the next 2 to 3 months. The United Nations allocated around $60 million from an emergency fund to help contain an Ebola outbreak in the Democratic Republic of Congo and deploying more staff. The World Food Programme is also expanding its emergency operations in eastern DRC to support efforts to curb the spread of the virus. Meanwhile, in neighboring Uganda, 3 new Ebola cases have been confirmed, bringing the total number of infections to 5. Authorities in Kampala stepped up surveillance and contact tracing efforts to contain the outbreak. The Ministry of Health said that all contacts linked to the confirmed cases have been identified and are being closely monitored. Uganda urged the public to remain calm and vigilant, calling on anyone displaying symptoms to seek immediate medical care. On the other hand, the United States has temporarily expanded its Ebola-related entry restrictions to include lawful permanent residents who have recently traveled to the Congo, Uganda, or South Sudan. The move affects individuals who have been in these countries within the past 21 days, as health authorities seek to reduce the risk of Ebola transmission. Bureau Report, DD India.
Meanwhile, a 12th hantavirus case has been confirmed after a crew member of the MV Hondius cruise ship, which arrived in the Netherlands last week for disinfection, tested positive. WHO Director General Tedros Adhanom Ghebreyesus said the Netherlands had confirmed the additional case and that the crew member had disembarked in Tenerife but was repatriated to the Netherlands, where the person has been in isolation. The incubation period for hantavirus is about 6 weeks. There are now 12 reported cases and 3 reported deaths. There have been no new deaths since 2nd May, when the outbreak was first reported to the WHO. Meanwhile, Dutch authorities said that the crew member had been taken to a hospital.
Brief update on the hantavirus outbreak among passengers and crew on board the cruise ship MV Hondius. Today, the Netherlands confirmed an additional case among a crew member who disembarked in Tenerife, was repatriated to the Netherlands and has been isolating since then. There are now 12 reported cases and 3 reported deaths. No deaths have been reported since the 2nd of May, when the outbreak was first reported to WHO.